Good morning, everybody. My name is Ricardo Romero Morales. I'm a lead public information officer with the County of Santa Clara. Thank you so much for being here today. Today, we are here to urge our youth to get vaccinated here in Santa Clara County. Today, we're also here honored by the following speakers. We have Dr. Marty Fenstersheib, who is the COVID-19 testing and vaccine officer for the County of Santa Clara. We also have Supervisor Cindy Chavez from the Santa Clara County Board of Supervisors, Dr. Rocio Luna, who is Deputy County Executive in the County of Santa Clara, Vito Chiala, who is the principal of Overfell High School. We also have Andrea Hernandez, who is a student here at Overfell High School. And today we're gonna start in English and American Sign Language. We will then move into a section of questions and answers. After that, we'll transition to statements from the podium in Spanish, Chinese, Vietnamese, and Tagalog. All right, without any further ado, it is my honor to introduce Dr. Marty Fenstersheib. Thank you.
Thank you, Ricardo, and welcome everyone. We're really happy to be here at Overveld High School. The message today is that the vaccines are our best path out of this pandemic. We need to get everybody 16 and older, those who are eligible, vaccinated, and the sooner the better. We can celebrate today because we know that we've vaccinated 2 out of 3 people that are eligible in our community and that have received at least 1 dose. That's over 1 million vaccines. And we are already benefiting from those that are vaccinated. We are seeing fewer cases of COVID and many less people becoming severely ill or dying of the disease. We've been able to get together now with our families who are vaccinated in small groups, and we are seeing our community slowly beginning to open up again. But we still have our work cut out for us. People are still getting sick from COVID. We are seeing nearly 100 new cases every day still. Our infections are higher in younger people, as we're seeing. And many variants, we know, are circulating within our community. So it's a race against variants at this point. Let me say to our young adults and our teens, it's your turn now. It's your turn. Help us get to the finish line. Only 1 in 3 teens, 16 and 17, has been vaccinated so far. And that's okay. They just started at the middle of April. But now it's time to step up and get vaccinated. However, in our Latinx community, it's only about 1 in 10 16 and 17-year-olds that are vaccinated. Remember, vaccines are safe and they work. I got vaccinated. My colleagues have been vaccinated. I insisted that my family get vaccinated, and they are all fine. The side effects are minimal and very short-lived. Getting sick with COVID is far more dangerous, and we've seen so many young adults with long-lasting symptoms. We now have the vaccine supply, and there are plenty of opportunities at our vaccine sites to either make an appointment or to just walk in. Just drop in. You don't need an appointment. Other providers, there are a lot of them in this community, have vaccine as well, including a lot of our local pharmacies. So your local Walgreens or your CVS also has vaccines. If you have questions about a vaccine and just not quite sure, talk to somebody that you trust. Maybe your faith provider, your healthcare worker, somebody else who's been vaccinated that can tell you about their experience. I assure you it will be okay. Don't wait any longer to do this. Every vaccinated person gets us ever closer to protecting our community and saving lives and getting back to normal. That's what we all want. Remember, even if you've had COVID, it's still important to get vaccinated. The protection from the natural infection is not as strong as what you get when you're vaccinated. And remember, if you've had your first dose, you need your second dose. Even if it's outside that 3 to 4 week window, it's still okay to get your second dose. Today, I call on all of you to get vaccinated if you haven't already. We are very thankful that we have access to these vaccines. Many parts of the world do not. We are all seeing what's going on in India right now, So take advantage of these vaccines. Make an appointment today or just walk up to any of the many, many sites that we have in our community today, or at least this weekend or next week. Thank you. And I'd like to now introduce Supervisor Cindy Chavez.
Thank you. I want to say how grateful and excited I am to be here at Overfelt High School. Overfelt High School is in the heart of the east side of San Jose. And what we know is that we have so many young people who haven't been vaccinated yet. And I'm going to, as a member of the Board of Supervisors, I've been talking to all of you quite a lot from the perspective of thinking about the leadership that we're getting from our health officers and the information that they're getting. But I want to take a moment just to talk about this as a mom. I have a 19-year-old son, and one of the things that we worry about for our kids is whether or not they're eating right, they're getting the right kind of medical attention, how they're going to be doing in school, all of those things. And so this is a decision that's not just up to the young person, but also it's a family decision. And so the one recommendation I would just make is to parents is, if you're nervous, go on our website. There's a lot of information. But I think the bigger risk is not having our kids vaccinated. I think the risks of the long-term impacts of COVID and some of it that we don't even know yet made me and my family make a decision to support our son getting his vaccination. The second thing I wanted to say is that there's kids are starting to go to college, and we all want to get back to school. The only way we're going to be able to open up these beautiful halls to young people who want to learn and get on with their lives is if we can get everybody vaccinated. And we are making it so easy. You can drop in. We're making later hours. You don't have to necessarily make an appointment. We want you to get vaccinated. If you're having a hard time getting vaccinated, you need to let us know, because this is a zero barrier approach that we're taking. We have enough vaccine. We want everybody to get across the finish line. Really the star of today's press conference is, we all love Dr. Marty, he's brilliant, and Dr. Luna, who you're going to talk to, is brilliant. And I'm a big fan of Principal Chiala's, he's amazing. But it's really Andrea, who you're going to hear from, that I think is really important, because the more I think young people are talking to young people, the better off we're all going to be. So, Andrea, I can hardly wait to hear from you. So thank you all. And now I get to introduce Dr. Rocio Luna, and she's going to tell you a little bit about her background and this place, I hope.
Thank you, Supervisor Chavez. Hello, everyone. I'm Rocio Luna. I'm the Deputy County Executive. I'm very happy to be here at Overfelt High School, my alma mater. Go Royals. I'm here because I share Dr. Fenstersheib's concerns, Supervisor Chavez's concerns. We have come a long way in this pandemic, but we are not done yet. We're not done until the hardest hit communities are vaccinated at the same rate as everyone else. And in the Latinos, we've got some work to do. So I'm calling on you to get your vaccine. We want to make sure we understand that everyone is working. You've got childcare responsibilities. You can't maybe get to a daytime clinic, which is why we are switching our strategy and making sure that we are able to offer more walk-ups, more pop-ups, more evening hours, more weekend hours. We're coming to you. If you can't come to us, we will come to you. Our in-home vaccination program is relaxing its eligibility. So if you feel that you cannot leave your home, call us and we will come to you. We know that, now I'm calling on our youth. We know that, schools are convenient. This is why we're here at Overfelt High School. Come to your school and get your vaccine. We're making this weekend, we have lots of availability, lots of pop-ups. You can get your vaccine here at Overfelt High School. You can go to the roller ring at Eastridge, take bus 22. You know how to get there. Go to the expo held at the fairgrounds. We'll come to you. We have same-day appointments at Levi's, also Levi's Stadium over the weekend. If you can't come on the weekend, again, just look at our website, look at our social media handles. You're going to hear about us being in your neighborhood. We're not going to give up until everybody is vaccinated, until everybody, particularly here in East San Jose. Help us get there. Next, we'll hear from Principal Chiala, as well as Jacqueline and Andrea, two current Overfelt students who share their experience with their vaccination. I'm grateful for them being here today, and I'm really grateful to Eastside Union High School District for hosting us and opening their doors. Thank you.
Good morning, everybody. Vito Chiala, I'm the principal at Overfelt High School, and I love welcoming you all to our campus. We are really honored to have the privilege of hosting a vaccination clinic here that's open from Thursday through Sunday, well into the summer. It's open into the evenings, and we're providing vaccinations to our community because this is a community that needs and deserves to be vaccinated and needs and deserves to have easy access to vaccinations. The fact that people can walk in, that they don't need to make an appointment, that they can come in after hours today, on Saturday, on Sunday, and the fact that they can bring their high school age students 16 and older in to get vaccinated is really a true honor for us to be able to host that here. This community deserves access to vaccines because they deserve access to being safe right now. It's really interesting that we're able to host a press conference in the middle of the school day at Overfelt High School on a Friday. Because a year and a half ago, this would have been a crowded place. There would have been 1,450 students in classrooms and out on campus. And today, if you look around, there definitely aren't 1,400 students here. You're going to get to meet Andrea in a little bit. Andrea spent her senior year on Zoom in her classroom. And that's the right decision, because keeping our community and our students safe is what's most important. But we also have a solution where we can bring students back, bring teachers back, and get moving forward with educating the future. And that's something that has to happen. The ability to do that, the ability to come back to school next year in person, in classrooms, to bring life back to our schools, only happens through vaccination. Getting our community vaccinated, getting our students vaccinated is critical. We don't want to lose another year of seniors to Zoom classes. Our students have done the very best, and you're going to hear from Andrea and several of our students all going off to colleges and doing the best they can. Our teachers have really stepped up to the challenge. They've had to modify their curriculum, and they're still educating at the highest level in spite of all of the challenges. But if you ask any of them if they want to do this again next year, they will tell you, get vaccinated, get us back together so that we can be safe and continue to bring our society, our community back to life. With that, I thank you for being here. I look forward, please, if you're listening to this message right now, get vaccinated, get our kids back in school. With that, I'll introduce Andrea Hernandez, who is an amazing graduating senior at Overfelt High School.
Hello everyone, my name is Andrea Hernandez and I'm a senior here at Overfelt High School. I am a captain of the varsity soccer club here at Overfelt and I am a part of the MVLA soccer club. One of the reasons why I got vaccinated is because in the fall of this upcoming year, I'm going to be going to Dallas, Texas in order to continue my soccer career and my education. I believe that it is important for our youth to get vaccinated. We are such a major part of our community and I feel like we have the most contact within the elders and adults here in California. I believe that we should all get vaccinated. Please, let's get vaccinated. Thank you.
Thank you, Andrea. Great job. We'll now take questions. We'll go to English questions first before we start the Spanish portion of the press conference. Please identify who your question is for, and we'll start with KPIX.
Hi, question for Andrea, if we can, please. Hi, Len Ramirez from Channel 5. Can you tell us, what do you suspect is going on with youth if they are not getting their shots? Is it a convenience thing, or is it something where they're afraid to do it or just reluctant to? What's your sense of that?
So I think one of the main things is is social media. I think that's one of the main things. In social media, there are a lot of rumors going around about how the vaccine is not important or how we don't need it because we're not a high-risk community, the youth. And I believe that that false narrative being spread around is causing the youth to not get our vaccines and to be reluctant about getting the vaccine. And I think once more people my age start coming out about getting the vaccine and how it is important, I believe that more people will be able to get it.
Yeah, as a
I think that more children or more kids my age should be going on there and telling everybody about how the vaccine is very important and how I got it, and how I want to keep everybody safe. And I think it's more of doing it for the community.
San Jose Spotlight.
Hi, Lorraine Dowry. A follow-up has been asked similar. Also with you in the county, are there any plans in the works to create a marketing campaign using youth as ambassadors to the youth?
So I'm going to have Dr. Luna follow up. But one of the things that we did last week, thanks for the question, Lorraine, is that we held our first community ambassador program for youth, and we had over 250 young people participate. And so what they're going to be doing is creating their own content and pushing that content out so that they learned about COVID-19, like kind of the 101 of it, a lot about vaccines. So now we're challenging them to come up with their own TikToks and other communication methods, some of which I hadn't heard of yet, to be frank. And so it was a really refreshing thing. But I will also say we did this in partnership with the County Office of Education, and I was so excited to see how many young people wanted to help. We have one more meeting with them tomorrow, and we're going to be reviewing mental health resources so that they can push those out to their friends and colleagues who may need mental health services right now. But I'll let... All right.
KCBS.
For Dr. Marty. Doctor, can you just touch, like, from a medical standpoint? It seems like I've had a few conversations with people, mostly younger, early 20s or so, who say, well, if I don't get a shot and I'm not going to get that sick anyway because of my age, but then someone that's older, you kind of assume, oh, they're already vaccinated, so I don't have to worry about their health now. Talk about why it's still really important for someone to be vaccinated from more of a medical standpoint.
Right. So the question is, why is it important for everybody to get vaccinated? And clearly it is. First of all, we don't actually know who's been vaccinated. So it's best that if everybody is vaccinated, we know we'll all be safe as a community. Young people have this misconception that COVID is no big deal. It is a big deal. And we've seen a lot of young people now hospitalized, young people with long-term infections that go on for months and months and months. The vaccine, maybe you get a little bit of a sore arm or even maybe a little bit of a fever for a day. Is that the price to pay for not getting your vaccine and putting yourself at risk for having COVID and ending up with a long-term situation? So again, we're not going to be safe until everybody is protected, and all young people, again, we're urging all young people to get vaccinated.
NBC? Nope. Any other follow-up questions? One more from KPX, please. Close it out.
For Rocio. Similar question. What's your sense of why Latinos are lagging behind in getting a vaccination? Is it the convenience because of working jobs and being out there, or is there some sort of barrier in terms of people being afraid to do it or just not knowing the sense?
Yeah, I think it's several of those. I think our Latino community is working. They're taking care of their families. They can't get out. They're working multiple jobs. They might be actually informally working as well, so it makes it even more challenging to get to a site. So I think it's important to have availability everywhere, places that they know and they're feeling comfortable, places they can walk to, and to ensure that we communicate effectively from the neighborhood-based all the way up through social media, all the way through websites. We know that a lot of Latinos don't have access to Wi-Fi, but they may not have phones. They can access the internet. So we want to make sure that we're spreading the word and that we're in neighborhoods and that they can easily find ways to get vaccinated at a time that's convenient for them.
Is there a similar social media message that's contrasting with your message that's out in the Spanish-speaking community?
Potentially, there could be potentially. Dr. Fenstersheib did actually touch on the notion that I think there's some misinformation about, you've already had it. If you've already had COVID, why get vaccinated? He made a really good point, which is that it's just not the same. You're not going to be as protected if you had COVID. I think a lot of Latinos, we know that Latinos have been hit hard by this pandemic. A lot of Latinos have had COVID. but it's not the same. We want them fully protected. Latino communities have to get their vaccine. Yeah.
All right, thank you so much. That will conclude our press conference in English and American Sign Language. We will now be moving into the Spanish portion of our press conference. Muy buenos días, mi nombre es Ricardo Romero Morales, soy oficial principal de Información Pública para el Condado de Santa Clara. Esta mañana nos encontramos aquí reunidos en la escuela secundaria Overfeld High School. Estamos aquí para pedirles a los jóvenes que por favor se vacunen contra el COVID-19. Mientras que más de 2/3 de la población del Condado de Santa Clara, mayores de 16 años, han recibido al menos una dosis de la vacuna de COVID-19, los líderes están preocupados por una reciente disminución en la demanda de vacunación e instan al público y a los jóvenes en particular a que se vacunen. La vacuna salva vidas, ayuda a prevenir la propagación de las variantes, las cuales son muy peligrosas, y ayudan a la comunidad a salir de esta pandemia. En particular, el condado está pidiendo a los jóvenes que por favor se vacunen. Sabemos que los jóvenes recientemente han sido elegibles para ponerse la vacuna y están haciendo un buen trabajo en ponerse la vacuna. Mas, sin embargo, también lo que sabemos que entre la comunidad latina, solamente el 10% de los jóvenes se han estado vacunando. Esto es algo alarmante, porque queremos que nuestra comunidad latina también se siga vacunando, ya que nuestra comunidad latina ha sido uno de los grupos los cuales han sido más impactados por esta pandemia. Queremos informarles que tenemos múltiples sitios para vacunarse. Tenemos lugares como Levi Stadium, donde la gente puede hacer una cita para ese mismo día. Pero también tenemos sitios en donde no se requieren cita previa, para que ahí la gente pueda ir y ponerse la vacuna. Este fin de semana estamos ofreciendo vacunas aquí en la Overfeld High School. También estaremos en James Licks High School, donde estaremos proveyendo boba y galletas a todos los estudiantes quienes se vayan y se vacunen ahí. Como sabemos, la equidad sigue siendo un enfoque principal para el condado de Santa Clara. Queremos poder llegar a las comunidades quienes han sido más afectadas. Estamos trabajando arduamente con las agencias comunitarias, con los residentes, con los miembros de nuestra comunidad para llegar a donde necesitamos llegar, ya sea que nosotros vayamos a ustedes, a sus vecindarios, para asegurarnos que tengan acceso a las vacunas. Más del 67% de las personas 16 años o mayores han recibido al menos una primera dosis de la vacuna y más del 39% ha completado la vacunación. Por favor, visite nuestro sitio web, el cual es el sccvacuna.org, para encontrar un sitio donde usted se pueda hacer una cita o también para ver dónde están las clínicas que no requieren cita previa. Usted también puede llamar al 211 para más información. Gracias. I will now transition into the English segment. I'm sorry. We will now transition into the Chinese segment. Thank you. We will now transition into Vietnamese. Thank you.
Kính thưa quý vị, giới chức lãnh đạo lo lắng về nhu cầu tiêm phòng đã giảm xuống và kêu gọi công chúng tiếp tục tiêm ngừa để bảo vệ mạng sống và ngăn ngừa các biến thể nguy hiểm lây lan, giúp cộng đồng vượt thoát được đại dịch. Trong khi có hơn 1/3 cư dân từ 15 tuổi trở lên đã được tiêm ngừa COVID-19 ít nhất là một liều, thì hạt Santa Clara đang lo lắng về nhu cầu tiêm phòng gần đây đã giảm xuống và kêu gọi công chúng tiếp tục tiêm ngừa để bảo vệ tất cả chúng ta, ngăn ngừa các biến thể nguy hiểm có thể lây lan và giúp cho cộng đồng vượt thoát được đại dịch. Buổi họp báo hôm nay nhấn mạnh về các cơ hội tiêm ngừa, bao gồm tăng thêm các địa điểm chủng ngừa mà không cần hẹn trước, có thêm giờ vào buổi tối và cuối tuần, cũng như các thanh thiếu niên chia sẻ kinh nghiệm tiêm chủng và khuyến khích bạn bè và cộng đồng tham gia cùng với họ. Với các biến thể nguy hiểm đang hoành hành và trên những khu vực khác trên thế giới như là ở Ấn Độ bị ảnh hưởng nghiêm trọng của siêu vi khuẩn, thì tiến bộ của chúng ta thật là mong manh và có rủi ro đi thụt lùi. Nếu vẫn còn do dự chưa muốn đi tiêm ngừa thì xin quý vị hãy nói chuyện với người nào quý vị cảm thấy tin tưởng để có thể trả lời những cái thắc mắc của quý vị. Nếu đã từng nhiễm COVID-19, tiêm ngừa là điều rất quan trọng. Chúng tôi không rõ là những kháng thể tự nhiên này có thể có hiệu quả được trong bao lâu, và chúng tôi cũng biết rõ là các thuốc ngừa thì sẽ có khả năng chống lại các biến thể có thể lây lan cho người đã từng bị COVID trước đây. Rất là hiệu quả. Thuốc ngừa có mức bảo vệ rất cao, không những chỉ cho việc nhiễm bệnh mà còn giúp cho không bị bệnh nặng, không phải đi vào nhà thương và ngay cả cho ngăn không có bị qua đời. Thuốc ngừa là cái phương cách tốt nhất để quay trở lại cuộc sống trước khi có đại dịch, và càng có nhiều người được tiêm ngừa thì quá trình đó lại được diễn ra càng nhanh chóng hơn. Chúng tôi đã chuyển các địa điểm tiêm ngừa hàng loạt thêm vào các buổi tối và cuối tuần để những người phải đi làm, phải chăm sóc cho người khác, phải đi học hoặc có các công việc khác trong tuần vẫn có thể được tiêm ngừa. Chương trình đến tận nhà để tiêm chủng mở rộng tiêu chuẩn để những ai không thể rời khỏi nhà để đến một địa điểm tiêm chủng vẫn có thể được tiêm ngừa. Với sự hợp tác của Sở Cứu hỏa và các cơ quan cấp cứu y tế EMS trong khắp quận hạt, chúng tôi cũng tập trung nỗ lực giúp người từ 16 tuổi trở lên có thể được tiêm ngừa tại các địa điểm thoải mái và thuận tiện cho họ, như tại trường trung học Overfell hôm nay. Cuối tuần, chúng tôi cũng có nhiều địa điểm tiêm chủng trên khắp quận hạt. Quý vị có thể ghé đến mà không cần hẹn trước. Hôm nay, ngày mai hoặc là Chủ nhật tại các địa điểm sau đây, như là tại trường Overfell, tại Aloha Roller Rink, tại thương xá East Ridge và Expo Hall tại khu vực hội chợ Fairground. Chúng tôi cũng có các địa điểm không cần hẹn trước tại các trường học, sở làm và nhà thờ khác. Vào cuối tuần thì chúng tôi cũng có những cái cuộc hẹn cùng ngày tại Levi Stadium. Nếu không thể tiêm ngừa vào cuối tuần này, chúng tôi sẽ gửi ra thông tin cho quý vị biết về những địa điểm tiêm ngừa cho tuần tới và những cái cập nhật thường xuyên tại trang mạng SCC FreeVax trong 5 ngôn ngữ khác nhau. Chúng tôi sẽ không ngừng cho đến khi tất cả mọi người đều được có cơ hội để tiêm ngừa. Hôm nay, chúng tôi rất cảm ơn trường Overfell đã cộng tác để cho trường làm địa điểm tiêm ngừa ngay cho cái khu vực phía đông thành phố San Jose, tức là East Side của San Jose. Xin quý vị lưu ý là hôm qua chúng tôi đã có 8.500 người đã đi tiêm ngừa. Trong tuần tới chúng tôi có được 91.000 cái cuộc hẹn cho tiêm liều thứ nhì và có 32.000 cuộc hẹn để tiêm liều thứ nhất. Cái địa điểm tiêm ngừa vào buổi tối sẽ được mở ra đầu tiên vào thứ Ba tuần sau tại Children of the Rainbow Park từ 1 giờ chiều đến 8 giờ tối. Xin cảm ơn quý vị. Chúng tôi là Như Hạnh, nhân viên truyền thông của quận hạt.
Magandang araw po, ako po si Crystal Ginto, Public Information Officer ng Santa Clara County. habang mahigit sa 2/3 ng mga residente ng Santa Clara County na may edad na 16 at mas matanda ay nakatanggap na ng kahit isang dosis ng bakuna sa COVID-19, ang mga leader ng Santa Clara County ay nababahala sa bagong pagbagsak ng demand para sa pagbakuna. At inaanyayahan ang publiko na ipagpatuloy ang pagbabakuna para makasalba ng mga buhay, pigilan ang pagkalat ng mga mapanganib na variant, at tulungan ang komunidad na makalabas galing sa pandemyang ito. Ang media availability ay magtatampok sa mga oportunidad sa pagbabakuna, kasama ang paglawak ng drop-in clinics na may oras sa gabi at weekend. Pati na rin ang mga karanasan ng mga local na kabataan na nakapagpabakuna na. At hinihikayat ang kanilang mga kaibigan at kapwang miyembro ng komunidad na sumama sa kanila. Para sa pinakabagong impormasyon tungkol sa mga bakuna, bisitahin ang website sa sccfreevax.org. Maraming salamat po.